you get the feeling that the room spins until the crystals stop moving. What are these tiny crystals? Where do they come from? What do we do? You get BPPV when they are not where they're supposed to be, doing what they're not supposed to be doing. Hey everybody, Dr. Jonny Crowder here with Neuroathletic PT, and today we're going to be looking at the real cause of spinning when you lay down or roll over in bed. If you like this content and you feel like this is going to be helpful for you or anybody you know, please forward it along or like and subscribe to the channel. But as we get into this topic, we're going to beat all things vestibular, inner ear, crystals, and the big word, vertigo. Now, I've said it before, but I always feel like it's important to say again, you feel vertigo. You don't have vertigo in terms of it is your diagnosis. Because vertigo, by definition, is that you or the room feels like it's spinning. It doesn't tell us why. That's the same thing like with pain. Pain says there is a problem. Pain is the symptom that I feel because there's a problem. That's exactly what vertigo is like. Vertigo is the symptom telling you there is a problem causing it. And so today we're going to be talking about a very specific type of vertigo. BPPV, Benign Paroxysmal Positional Vertigo. This is often described as the classic type of vertigo. When people say the crystals are loose, that's what this is. And so we're going to look a little bit at the anatomy and what's happening, and then we're going to talk through the whole diagnosis, what it can do, what it can cause, and then we'll talk through how to fix it. But there's going to be other future video on all the maneuvers of how you actually totally get rid of BPPV. So, what are these tiny crystals? Where do they come from? What do we do? So, when we look at the inner ear, which is on the other side of the eardrum, you have two organs are called the saccule and the utricle. Both of these organs have hair-like projections that come out of them, a gelatinous jelly-like matrix that's around it, and then on the outside of the matrix, you have these crystals. They are technically calcium carbonate, and in medical terms, we call them otoconia. Crystals is just an easier way to describe them because truthfully, they look like tiny crystals. And so, what these should be doing is hanging on those hair cells to give you an orientation according to gravity. When you accelerate, the acceleration pulls the crystals because they have weight, and that pulling gives you the sensation of acceleration. So the crystals are there. You want the crystals. You don't want them gone. You just want them where they should be, doing what they should be. Now, you get BPPV when they are not where they're supposed to be, doing what they're not supposed to be doing. That's when you start to have BPPV, feel vertigo, and have problems. And so, what causes BPPV? There's several things. And so these calcium carbonate crystals, they tend to model and shape kind of like bone in the body does. And so things that promote bone density also tend to promote stronger density and sticking of those crystals. So as a supplement, vitamin D plays a huge role in bone density. Vitamin D is one of the only supplements that's known to decrease the risk of having and decrease the risk of getting BPPV a second, third, fourth, fifth time. And so there's supplements that you can take. But then in general, I recommend everybody do strength training because the more you promote bone density, it's only going to help in the inner ear system. Now, why do they fall off? You have traumatic and you have atraumatic causes. Traumatic causes are like you get in a car wreck and you hit your head on the steering wheel. Forcefully, it's such a big jarring moment that it shears and pulls the crystals off of where they're supposed to be. That can happen. Another common one is you fall and hit your head. That forceful when your head hits knocks the crystals off where they're supposed to be. And then we get into atraumatic causes. And so when you have atraumatic causes, that's where something is happening that's degenerating and wearing down these crystals so they're not as big and round and sticky as they should be, but instead they kind of get withered away, kind of like weak bones do, and then they start to fall off more commonly. And so things that can cause this, number one, arterial disease. And so if you have arterial disease, atherosclerosis, or anything like that, it also decreases the blood flow to the inner ear. And that's how the crystals and everything get their nutrients to stay strong, so they start getting weaker. Smoking can also make them a little bit worse. And so most activities that keep the human body healthy seem to keep the crystals pretty healthy. And so we want to keep them as healthy as we can. Now, that when they fall off atraumatically, you didn't hit your head, you didn't fall, you didn't do anything wrong. The crystals have just lost their integrity and strength and ability to stick together well, and they just start shedding, as we call it, or falling off of where they're supposed to. Now, just because they fall off of there doesn't guarantee you get vertigo and BPPV, but normally the crystals fall off when you're laying down in bed, or when your head is up or your head is down really far. What that'll do is it puts the canals in your inner ear. You have 3 canals on both sides. So let's say you're laying down slightly to the right. If the crystals fall off, they drop right into the posterior canal, which is the most common canal to have BPPV in. And so with the posterior canal, if the crystals had fallen in there, they're floating in there. When you lay down, normally there's fluid that moves when you lay down and stops moving. But when you lay down, the crystal floats from the top to the bottom of the canal based on your position to gravity. When that crystal's floating, it's moving the fluid, which moves by the hair cells in the inner ear, and it tells your brain you're moving when you're not actually moving. And as we've talked in other videos with the vestibular ocular reflex, what it does is when it detects movement in the inner ear, it should make your eyes move in equal and opposite speed. That way what you're looking at in the world should stay perfectly stable and steady in your visual field. But when you lay down, the fluid moves and stops moving. The crystals slowly move to the bottom part of the canal based on gravity and where your head is in space, causing the eyes to jump rapidly. You get the feeling that the room spins until the crystals stop moving. That is what's causing the vertigo. Now, the position that you're in that causes vertigo, it can give us an idea of what canal and which side has the BPPV, but more specifically, we can know that by looking at your eyes when you do the tests for BPPV, which the primary test is the Dix-Hallpike, and then the roll test is the other primary test, and we'll have videos on how to do those at home and what to look for. But the direction that your eyes jump and move, that's what tells us what canal are the crystals in. It's really important to know which canal and which side the crystals are in, because otherwise the treatment maneuvers that we use to get the crystals out of the canal, we might do the wrong one and then we won't be effective. And that's something that I see commonly is where people come in and they say, I tried this on YouTube and I tried this and my doctor gave me that. But when they try all of those, they did it with the hope that it was the right one, but nobody actually diagnosed what side, which canal, what maneuver is most effective, and they were doing the wrong one. And so when you do the wrong maneuver, you make yourself really dizzy, maybe nauseated, you might feel miserable, but you're not going to fix it. And yeah, that would be miserable to do that over and over and over again and never get better. And so I understand why people feel upset and frustrated when they're not getting the results that they are hoping and think they should, but it's truly because they don't actually know exactly where the crystals are in the diagnosis. And so to summarize all of BPPV together, what we see is the crystals should be on one organ. They've fallen off and gotten in the canal. Depending on which canal is affected, the posterior canal is typically when you lay down, when you sit up, when you tip your head up like you're looking in an upper cabinet, when you bend down to tie your shoes. Big changes in head pitches make the room spin for 10 seconds to 60 seconds roughly. The horizontal canal is primarily when you roll to the side or with fast changes in head position sideways in the horizontal plane. That's going to affect the horizontal canal and when you'll get dizzy much more so. The anterior canal is a little bit unique in that Almost nobody has that ever. There are some cases where people will get crystals in the anterior canal, but the exact same positions as the posterior canal make you feel dizzy. So the big head movements up, down, laying down, sitting up, all of those are also going to make you dizzy with the anterior canal. And that's where looking at the eyes makes the biggest difference. Now, to go a little bit deeper, there's two types of BPPV. One is called Kenolithiasis. That means the crystals are free floating in the canal. They're not stuck. That's the typical and most common type. The symptoms of that are you lay down and the room spins for 10 to 60 seconds and then should settle. You might feel a little uneasy, unsettled, a little dizzy, but the real spinning is totally stopped. Then there's Cupulolithiasis. Now for Cupulolithiasis, that's where at the end of the canal, there's an organ that sticks up called the cupula, and it has hair cells. And so when that one gets crystals that stick to the organ, that's Cupulolithiasis, where the crystals are stuck on that organ. The difference with that compared to Kenolithiasis is Kenolithiasis, again, the crystals move, push the fluid, moves the hair cells, you feel spinning until the crystals stop moving. Now when the crystals are hanging on that organ, you lay down, the weight of the crystals pull the organ and pull all the hair cells. Cupulolithiasis, depending on which canal it's in, when you lay down, the way it pulls the hair cells and doesn't stop pulling them because of your position with gravity, you have vertigo and the room will feel like it's spinning for more than 60 seconds. That's how that one gets diagnosed. Typically, even though the room will keep spinning, if your brain feels the room spinning, your brain says, I don't want to feel that. I'm going to decrease how much signal comes through. And so the longer you stay there and the room keeps spinning, your brain will feel less and less and less and less until you don't feel dizzy anymore, but the cells are still being stimulated. You're still getting those signals. The brain is just learning how to not pay attention to that. Good thing, you don't feel dizzy now, and you don't feel the room spinning. Bad thing, your brain is learning how to not use one of its sensory systems. Your balance is going to start getting bad. Your ability to walk and turn your head and move, it's going to start getting a lot worse in a much faster way than just the Kenolithiasis, because it's constantly giving that stimulation, and so your brain is constantly trying to learn, how do I use my vision? How do I use my somatosensation? How do I decrease the signals from my vestibular system? And when your brain starts to learn those patterns, at first it's neurochemical, and so the brain just decreases how much signal can come through. But if you have this for more than 3 months, the brain starts to make structural changes. The brain will increase the density and how strong the signals are to the vision, to the somatosensation, and then the nerve that actually connects and controls to the vestibular system, it starts truly getting smaller. In the same way that if you're exercising, it's one thing for you to not lift weights as much, but you do it just enough to where it stays strong. But then let's say you stop using all the muscles. Your muscles start getting weaker. They start getting truly smaller. You take a few days off from the gym, it might take a warm-up to feel all the way normal, but your muscles are still just as strong. In the same way that if you have Cupulolithiasis, if you have it for a couple days, your brain's trying not to use it, but everything is still capable. Your brain is just learning to decrease the signal. But when you do that for months on end, it can be catastrophic as far as how much dizziness and how many problems it can give you. Now, for rehabilitation of that, you're going to see it in future videos. Number one, you have to get the crystals off of the cupula, and then once it's off the cupula, they are floating and becomes Kenolithiasis. You have to then do canalith repositioning to get the crystals out. And then you have to train the vestibular system. Just like you train your muscles to get them strong again, you have to train your vestibular system to get better. In the same way you don't get strong overnight with your muscles, your vestibular system doesn't get strong overnight. And it can take weeks to months of training specifically to get that system fully operational again. But that's the goal. At the end of all of this, no matter what diagnosis you have, we want your vestibular system to be fully operational so that you can do all the things that you want to do. You can go play and have fun and lay down and roll over and not always worry about, I don't know if I want to do this because the room might start spinning and I might get off balance. And that's a miserable way to live everything if it can get better. And so the whole goal is to improve your human performance, which is why I named this channel Neuroathletic PT. It's because I want everybody to live to their full athletic and capable potential in a good way, not with symptoms and not with problems. And so that is BPPV. And so we're going to have more videos that are going to go through the tests to know where the crystals are and which side the crystals are on. And then we're going to have more videos to actually help you learn the maneuvers of how are you going to get the crystals out, and then how are you going to get them unstuck if you do have them stuck, like in cupulolithiasis. And so if you've liked this video, please like and subscribe to the channel, and then please follow us for more content as we begin looking more deeply at how we're going to fix all the problems that you have. Thanks for watching.